In anatomy and physiology, we use very specialized terminology in order to describe the position of the body, the direction of, if you're, say, for example, making a surgeon's making a cut, what direction is that surgeon making the cut? We can also refer to body regions and specific structures. And we do this in order to decrease misunderstanding because up and down and left and right and knee and elbow, those can actually mean different things depending on who you're talking to. So let's take a look at some of the special language that we use. So first of all, we have regional terms, and these are terms that are just related to kind of specific areas of the body. And a lot of these might sound familiar to you if you just kind of think about it, and others you'll have to just kind of memorize as you learn them. But for example, the carpal region, if you think of the word carpal tunnel syndrome, you may know that that refers to kind of a painful inflammation of the wrist. And you can see here that carpus or carpal refers to the wrist region. Another kind of good example is the knee. So the knee could mean the front of the knee or the back of the knee. So by being a little bit more specific, we can say patellar region or the patella because that's the kneecap. So we know that that's the front of the knee, whereas the popliteal region is the back of the knee. So for example, if you're a surgeon, you want to know exactly where you're going to be conducting that knee surgery. Is it going to be on the patellar side or the popliteal side? So take a look at these and look at the ones that maybe stand out to you that you already know. Some other kind of common examples might be, let's see. So like mammary. So mammary has to do with the kind of the breast area. So think of the mammary glands. Abdomen or the abdominal region, that's a pretty common one. Umbilicus, so your umbilical cord is attached to your belly button before you're born, and so that's the umbilical region. You also have the pelvic region, the femoral region, which the bone that goes through your thigh is the femur. And some other ideas, for example, dorsal. Think about the fin on the back of a dolphin or a whale. That is the dorsal fin. So take a look at these, study them, and try to make those connections as you're learning them to words that you may also, or words that you might already know that are related to that area. Now, we also talk about directions and we don't use terms like up, down, left, right, under, over when we're talking about the human body. And that's because people move around. So if a patient walks into a doctor's office, they're not always going to be standing up. Maybe they're sitting down in a wheelchair, maybe they're laying down on a gurney. And so up can have many different definitions to it depending on the position of the body. So in anatomy and physiology, we standardize the position of the body. So regardless of whether someone is standing up or laying down or sitting, then we know what up means. And we actually don't even use the term up, we use the term superior. So first of all, let's take a look at what the anatomical position is. The picture on this slide here shows the anatomical position. So it's a person standing erect or upright, facing forward, with feet also facing forward. Hands are down at the sides with the palms facing forward as well. So like I said, the reason why we have to have these kind of special directional terms that are based on the anatomical position is to reduce confusion. So instead of saying something is above something, which depending on whether you're standing up or lying down, above can mean different areas of the body, we say things like it is superior, meaning that it's closer to the head. So let's take a look at some examples. And one thing to keep in mind is that directional terms are relative to other structures. So something can be above one thing but below another thing. So one example is the belly button is superior to the feet. Superior means closer to the head. So we can all agree that the belly button is closer to the head than the feet are. But the belly button we could say is inferior to the head. So even though the belly button is superior to some structures, it is inferior to other structures. So it's important to kind of give the more of the big picture as to what something is. So you can't just say the belly button is superior because it's not always superior depending on what you are comparing it to with the other structures. So let's take a closer look at these directional terms. First of all, we can look at superior, which is also sometimes called cranial or cephalad. Superior just means that something is closer to the head or the upper part of a structure or the body. So instead of saying that it's up, we say that something is superior to something else. So using that example on the previous slide, the belly button is superior to the feet. Inferior, which is also known as caudal, is just the opposite of superior. So it means away from the head or basically closer to the feet. So the belly button is inferior to the head because the belly button is closer to the feet than the head is. Ventral, which can also be called anterior, means towards or at the front of the body. So your sternum, which is your breastbone, is ventral or anterior to the heart because your breastbone is closer to the kind of the surface of your body than the heart is. Dorsal, which is also called posterior, is towards or at the back side of the body. So your heart would be posterior to the sternum because it is closer to the back of the body than the sternum or the breastbone is. Medial means towards or at the midline of the body. So think about if you were to draw an imaginary line right down the middle of the body, that would be the midline. So anything that's close to the middle of the body would be medial. So for example, your backbone is medial to your shoulder blades. Lateral is just the opposite of medial, meaning that it is farther away from that midline. So your shoulder blades would be lateral to your backbone. Proximal and distal primarily have to do with the arms and legs, although they can refer to other structures as well. So the arms and the legs are attached to what we call the trunk of the body. And these terms are related to the attachment point of that limb to the body. So for example, with arms, the arm is attached to the trunk at the shoulder. So we could say that the elbow is proximal to the wrist. And that just means that the elbow is closer to the shoulder than the wrist is. With the legs, we could do the same thing where the hip is the attachment point of the leg to the trunk. So we could say that the knee is proximal to the ankle. Distal is just the opposite of proximal, so it just means that it's further away from that attachment point. So you can think of proximal, think of the word approximate. If something is approximate, then it's close. Whereas distal, you can think of the word distance, meaning that it's further away. So in the same examples, we could say that the wrist is distal to the elbow and the ankle is distal to the knee. Superficial means towards or at the body surface. So think about like a superficial cut on your skin might not draw blood and it might only affect the outer layers of the skin, whereas deep means that it's more internal or deeper into the body. For example, if you were to step on a nail, if that nail went through all the layers of the skin and through the connective tissue and into the muscle, that would be a much deeper wound.